Hi there.
Hi. Is this Mr. Rahman?
Correct. Who's this?
Hi, this is Mohammed, the doctor from Tic Health in Edgware.
Hi, Mohammed. How you doing?
Hi, not bad, thank you for asking. I was asked to give you a call to talk to you about your scan result.
Correct.
Have you seen the report yourself?
I have seen the report, and I'm not satisfied with the report, and I want you to go deeper into the findings and what you think of it. Like, explain it to me,
Sure. Which part of the report isn't to your satisfaction?
I mean everything. As I mentioned, I have been suffering from the pains in my organs for quite a while, and it's only gotten worse. I was, you know, it says so the CT scan showed actually it was an MRI that I done at Hendon Hospital that showed apparently there was a hemorrhage. Again, I was not satisfied with that report as well because it does not mention the pain that I'm having in my left kidney and my liver as well. But I just want you to go deeper in the report that you guys have analyzed from your radiographers.
Yeah. So I mean, the positive findings about of the report in terms of what they found, which is abnormal, I guess you could say, is that on the top of your right kidney, you have a cyst with a bit of bleeding within the cyst, a hemorrhagic cyst. And this is basically what you explained to me that was found on your previous self imaging. Apart from that, in the right kidney, there was nothing else noted. And in the left kidney, everything seemed to be okay. It was the right size, the right shape, and all the tissues were there within the sort of right dimensions. In your liver, there was only thing that they noticed is that there was a bit of fat within the liver, which again is somewhat normal. Around 20 to 30% of people have a bit of fat inside the liver, but that's not a cause for any pain or any disease. The rest of your organs, your gallbladder, your spleen, the adrenal glands which sit on top of your kidneys, your pancreas and your stomach looked absolutely fine. Your bowels, again, didn't look abnormal. There was no lymph nodes in your abdomen. And also sort of your bladder and your pelvic joints were okay. So that, I mean, in general, if it's to summarize, it basically is just that finding of the hemorrhagic cyst and some fat in the liver. But I'm not too sure whether either of these explains the symptoms that you're experiencing.
Yeah. Like I said, my organs internally are in a lot of pain, and I have got to the bottom of it, why that is, why you are seeing fabricated scans on your screen. But I just want to know a bit more about the hemorrhagic cyst that you have mentioned in my right kidney, was it?
Yeah, right kidney, yeah.
Is that still bleeding, you said?
It says, give me just a second, sorry about that. Let's have a look. So, it won't say whether it's bleeding because it's a static image, so it will only take a snapshot of your abdomen. It says that there's blood within it. Now, how old the blood is, I'm not too sure. But given the fact that you've had imaging recently with a similar finding, it's probably the same that it was previously. Hemorrhagic cysts in the kidney are quite common. Again, they're not usually a cause for pain or even a cause for any concern. But in these situations, when we find bleeding within a cyst, I would usually advise seeing a urologist to get some advice. But like I said, I'm pretty sure this doesn't explain what you're going through.
Yeah, no, I'm still not satisfied with it. Was there any finding of scoliosis?
Scoliosis. Let's have a look. There is no mention of your spine. But like I said
No, because
before,
incidental finding of mild scoliosis that I did not discuss with your team anyway, but somehow it's there.
oh no, that's in the clinic. That's in the referral. Because you mentioned it to me, so I
Okay.
put all the information there, so the radiologist has an idea of what's been going on with you. So that's why I said you've had a 1-year history of pain, etc.
Do you know the size of my liver?
The size hasn't mentioned the size of it. It says your liver is normal in size, but they don't usually mention the dimensions. They don't usually measure the dimensions of the liver because it's an oddly shaped organ, but it says normal in size.
Okay, so I just want to say, yeah, it says the CT scan showed hemorrhagic, right? That's actually an MRI that I done at Hendon Hospital for the abdomen.
Okay.
So that needs to be changed. And like I said, I've told you about my poisoning condition where I was poisoned, and internally that has left my internal organs destroyed. And now, to cover this up, there has been a big fabrication team that is hacking the MRI machine itself. So to cover up the truth, obviously. So that's why the radiographer is only seeing, a scan that has been replicated from, just to keep up the same scans. I just want your team to know this. Is obviously you cannot do anything about it because they've covered it up nicely. Do you think there will be a possibility of doing a ultrasound at TIC to see a better imaging of the cyst that is mentioned in the reports?
Yeah, I think an ultrasound is probably a good idea as a next step. Unfortunately, we only do ultrasounds of joints here. We don't do ultrasounds of abdominal organs. So if that's something you want to pursue, it's probably you're better to look for another clinic or a imaging provider to do that.
That's fine. Like I said, because I had an ultrasound done after the finding at Hendon Hospital where they mentioned the hemorrhagic cyst, and after that there was no mention of the cyst being there in the ultrasound, and somehow it has appeared back in your MRI. So the things just don't add up, how they're not showing the ultrasound, but for somehow it has appeared back in the MRI. So
I think it's probably unlikely that it's gone and come back again. I think probably the likelihood is that the person doing the ultrasound didn't notice the cyst, missed the cyst, or thought it was something else. I can't really comment on it, but I think it's really unlikely to have two hemorrhagic cysts in exactly the same place in the same kidney in a short period of time. I think we're probably looking at the same one, but I can't really make comment on another person doing a scan. Have you been referred to a urologist about this cyst?
I've told my GP. They said it's gonna take a while, and then at the moment for my pain, just take 3 paracetamols, which I find ridiculous. But again, I've been doing everything I can from my end to keep up with this. Like I said, I have to do these scans, for my survival, as I'm in a lot of pain and there's nothing being done about it, and it's making me go back and forth, and keeping me in this vicious cycle of chasing up the GPs, doing this privately, doing this that, even though it's pretty clear that my internal organs are destroyed, and I've got to the bottom of where I've tracked down how this fabrication team there's a fabrication team behind hacking into the MRI machines itself to appear, like, for it to show fake scans to the radiographer in real time. So meaning, what the scans.
Have you told your GP about your ideas about fabrication?
Oh no, again, I've told them, because all my scans are with me like that, and then they're keeping up with it. Just cover up the truth and everything. But like I said, I've got to the bottom of it. I've reported to police and everything, and
reported to police.
Again, I was expecting police to contact Tic Health to make sure that this doesn't happen again, but clearly they haven't done so. But again, you guys have done. You guys are only going by what you see on your screen, and you have given me a similar report of the same thing, but for some reason the hemorrhagic kidney cyst is still there, and it does not match the ultrasound report that the NHS provided me with. So again, their story is is not matching with the reports are not matching, and they got caught in it themselves. Again, I'm pursuing this further, but again, thank you for your team for doing this imaging, and let's see what's next. And
I mean, that's not a problem. Like I said, if you wanted me to have a discussion with your GP about this, obviously it has to be with your permission. I could always talk to them about the scan result. I give them sort of my recommendations to be referred urgently to see a urologist. But that's up to you. But I'm more than happy to send them a letter or speak to them over the phone.
Yes, please. Why not? If you want, that would be great. Again, I've told them for some reason they have said it will take 3 months. I could be dead in 3 months. Who knows? But like I said,
Fine.
I've tracked down my whole journey, to make sure I keep up with them. Again, like I said, there's a lot of evil behind it. That is making sure I
Yeah.
do not get I do not get my real scan results and everything. And I've managed to track it down how that is possible, and it's just doing what I can for my own survival.
Yeah, no, I understand. I understand. You have to do what's best for you. Which GP practice are you registered with?
Loxford Polyclinic at Ilford.
Where is that again?
417, I think, Loxford.
Oxford Polyclinic. Which area is that in?
Ilford.
Ilford, okay. Yeah, no worries. I mean, if I can speak to them, I'll speak to them. But if not, I'll send them a letter just explaining a summary of what's happened here.
Yeah, if you can just send them the current report of...
Yeah, I can send them. I can send them the report in full. Yeah, that's no problem. And then hopefully they can contact you to discuss. I mean, at the very least, even if they can't do anything about the urgent referral, they should be able to manage your pain a bit better.
I mean, for them is to analyze the report carefully and then making sure that the hemorrhagic right cyst, like I said, they keep diagnosing me one problem after another, and it does not, like I said, they cannot explain the pain I'm having in my left kidney similar to the right one, so they can't say, next time they just can't say that I have another hemorrhagic cyst in my left kidney as well, and my liver also being more than destroyed. Just sticking with the story with mild fatty liver, because in my scan at Hendon Hospital, they done it with contrast and they did not even mention the mild fatty liver. So this is why they've been caught out with manipulating reports and everything. But if you can send them the scan reports, I can discuss with them that somehow the hemorrhagic cyst in the right renal cyst is still there, and which they did not mention in the ultrasound, and then we can see what can be done next.
Yeah, fine, no problem. I'll get this all sent across to them. No issues.
Perfect. Thank you very much.
No worries. You take care.
Have a good day.
Thanks. Bye-bye.